If your baby is struggling with wind, chances are you've tried lots of different remedies to help them with it. There are also hundreds of products out there promising to help calm your baby and soothe their wind and their colic. But what none of these deal with is actually the mechanics of how your baby's stomach works and where the issue might lie. I'm going to show you a technique you can use today for winding your baby that really helps to deal with trapped wind and to make your baby more comfortable. So the first thing we need to understand is that your baby's stomach isn't a perfect circular shape. It has this little pouch area at the top. Now we all know that when we get air bubbles in liquid, the bubbles will always float to the top. So they will sit at the highest point. And unfortunately, this little pouch actually sits higher when your baby is upright than their esophagus. Their esophagus is their food pipe, this is where their milk goes down, and also where those air bubbles need to get back up again. So because of the shape of their stomach, these bubbles sit up the top in this pouch, and it's very hard for them to get round the corner and out the esophagus with traditional methods of winding. What I'm going to show you today is a technique called Wonky winding, which helps to allow these bubbles to be freed and get out of your baby's esophagus, allow them to burp and to feel more comfortable. It's really simple. So all you need to do is position your baby so that they're on a diagonal. Now you want to make sure that you've got their head on your right shoulder, their body down towards your left hand side. This is really important because of the shape of the stomach and where it's positioned. So we want your baby on that diagonal, head on your right shoulder, body turned towards your left. And then we're going to give them firm pats on their back, and you can intersperse this with some circular rubbing motion. And you can also include movement. So sitting on a birth ball while you're doing this, or standing up and moving around and bouncing up and down also helps to get those bubbles moving. By putting them on this angle, it means that we're making sure that that little pouch area where those bubbles are collecting is actually lower than the outlet to the esophagus, so those bubbles can float round. And now where we want the bubbles to come up into their esophagus to allow baby to burp, that's actually now the highest point rather than this little pouch at the top of their stomach. If you're burping your baby with them sitting on your lap, you can achieve exactly the same thing. Just make sure you lean your baby towards their left hand side. Many parents ask me whether breastfed babies actually need to be burped. And the short answer to this is not always. If your baby comes off the breast after a feed and they're content and calm, they've fallen asleep and they seem comfortable, leave them be. If they are wriggling and writhing, arching their back or drawing their knees up to their tummy, then this might indicate that there's some wind there for them, and we then need to give them the chance to burp. The more time you can keep your baby upright and moving in the day, the less chance it will be that they'll have trapped wind. So wearing your baby in a sling or a carrier is a really good idea, even if you're just moving around the house. A baby who is latched well to the breast and has a good seal with their mouth and good tongue function won't take in air when they're feeding. They will still create some air in their gut while they're digesting, just like we do as adults, so it's normal for them to still at some points have wind to pass, but most babies can pass this fairly easily on their own. If your baby is really struggling with wind on a consistent basis, it's worth getting some support with their feeding to determine how well they're latching, whether they're not getting a good seal at the breast, or they're breaking the seal, coping with milk flow, slipping off, or whether there might be something like a tongue tie going on which is impacting how they can latch and feed and therefore increasing the amount of wind they get. If you are giving your baby supplementary bottles or you're using something like nipple shields, this can also contribute to the amount of wind they have as well.